ATLS isn't just a protocol, it's a lifeline.
Every second, every decision counts. Never forget the basics.
Today, we're not just treating patients, we're teaching you. To the next generation of trauma providers, welcome.
This is where theory meets reality.
Always start with the primary survey. Airway, breathing, circulation, disability, exposure.
That's the algorithm of life.
You've seen the chaos. You've seen the cases. But trauma care is built on reminders.
Remember your ABCs: airway, breathing, and circulation.
Reminder, children are not little adults. Their physiology is different. Use a length-based tape for all weights, doses, and equipment.
Reminder, the 10-second assessment. Ask the patient their name and what happened. A clear response tells you their airway is patent.
Reminder, when you suspect a spinal injury, the airway maneuver is a jaw thrust, not a head tilt. Protect the spine. Reminder, a normal pause CO2 in a pregnant patient may indicate impending respiratory failure. They should be hypocapnic.
Reminder, do not delay decompression of a tension pneumothorax to wait for radiologic confirmation. It is a clinical diagnosis.
Reminder, for an open pneumothorax, tape the dressing on 3 sides only. This creates a flutter valve effect.
Reminder, tachycardia is the earliest sign of shock. Hypotension is a late and ominous sign, especially in children.
Reminder, a transient response to a fluid bolus means one thing. The patient is still actively bleeding.
Reminder, when you can't find the source of a bleed, remember, on the floor and 4 more: chest, abdomen, pelvis, and long bones.
Reminder, apply the pelvic binder over the greater trochanters, not the iliac crests, to effectively close the pelvic volume.
Reminder, a properly applied tourniquet should eliminate the distal pulse. If it doesn't, it may be increasing venous bleeding.
Reminder, in geriatric trauma, a systolic blood pressure of 110 can be hypotension. You must know their different normal.
Reminder, a patient can be talking to you 1 minute and herniating the next. Never underestimate a lucid interval.
Reminder, the primary goal in head trauma is to prevent secondary brain injury. This means you must prevent hypoxia and hypotension.
Reminder, remove your patient from the long spine board as soon as possible to prevent pressure injuries. Spinal motion restriction does not equal the board.
Reminder, the most sensitive sign of compartment syndrome is pain on passive stretch of the muscle. Don't wait for a lost pulse.
Reminder, in burn resuscitation, the fluid calculation is your starting point. You must titrate the rate based on urine output. Reminder, a circumferential burn on the chest or a limb is a surgical emergency. An escharotomy may be required to restore ventilation or perfusion.
Reminder, for the pregnant patient in the second half of pregnancy, always displace the uterus to the left to prevent vena cava compression.
Reminder, all Rh-negative pregnant trauma patients should receive Rh immunoglobulin, unless the injury is remote and minor.
Reminder, when transferring a patient, use a clear communication tool like ABC-SBAR. It ensures no critical information is missed.
Reminder, when transferring a patient, use a clear communication tool like ABC-SBR. It ensures no critical information is missed.
Reminder, don't delay a life-saving transfer to get a CT scan that won't change your immediate plan. Time is the most critical resource.
Reminder, always maintain a high index of suspicion for intimate partner violence when the story and the injuries don't align.
Reevaluation is not a single step.
It's a continuous process. These are the reminders.
This is the algorithm of life. Now it's your turn to practice it.